athletes, clients, patients. We want to have our clients and patients, number one, do the kinesiology of the offending movement. And in other words, we want to understand what muscles are primary movers, what muscles are secondary assisters, what muscles will be the antagonistic muscles, what muscles would be secondarily stabilizing a joint, if not the primary joint, a joint above or joint below. So we want to think about the new kinesiology or the new functional anatomy. Just because we're doing a bicep curl does not mean the biceps are the only muscle that is working. Or brachialis, quite honestly, we know brachialis really does all the work. The bicep is there for show. So we could say brachialis is for go, biceps for go. Similar that we would say the relationship between gastroc soleus in a new functional anatomy way of thinking. We practitioners want to assess for the presence of trigger points. How do we do that? I have outlined the trigger point protocol in previous webinars, and I'll sort of begin from the beginning again, starting in 2014. So we'll be going back to some of these key concepts. This webinar does not have the time to discuss how to do the assessment. All of you listening, I'm sure, have your key range of motion assessment tests that you do, whether they are functional, passive, or active. But we want to recognize that the presence of trigger points in primary force producers can, if they are present, be implicated in the future potential for injury or pain. When we're doing this assessment, we want to be able to assess not only the primary force producers, but we also want to